Hey, Global CE Day. I'm so delighted to have Paolo Lago of Italy here with us today. And hey, as you were just saying, Paolo, before we came online, that a year ago there we were in Rome, in your backyard. And so thanks so much for that great program that you and Stefano and Lorenzo and many others, Umberto, put on. So, Paolo, you've had quite a job during COVID, and you have quite a job anyway. And oh, by the way, you also run a WHO collaborating center. So tell us about all that.
Yeah, my job in this period is very important for my hospital and for the community of clinical engineers in Italy. Why it is important? Because in my hospital there were many patients, many COVID patients, and our work from March is to collaborate with the clinicians in the unit of crisis established for this emergency, and to settle new beds of intensive care, and to move ventilators, monitors all over the hospital, and to improve, to foster all the initiatives useful to combat this virus. And also together with my colleagues all over Italy, we are in touch to support all of the hospital regionally and nationally. So the network of clinical engineers regionally and nationally was very useful to have a good impact on the healthcare system.
Well, I believe, Paolo, you've been, as you were saying, you were one of the parts of Italy that was hard hit early on with COVID. Talk about that in a moment. I know you did. You talked about ICU beds. You talked about moving ventilators around. So AIIC, the National Clinical Engineering Society of Italy, has been very strategic in combating COVID, I know, and with many webinars and many resources. So how do you guys communicate, guys and gals? What's up, or, in other ways, how do you communicate with all these colleagues?
The way to communicate with my colleagues was with teleconferences, and also about all of the biomedical instrumentation we use to combat COVID, and also to disinfect instruments, the way to use instruments to combat COVID, and to reorganize hospitals as to emergency rooms and so on, to collaborate with clinicians and with the chiefs of the hospital to reorganize all the hospitals. So we have reduced the normal activities of the hospital, the program activities on the hospital, and we focused on the emergency. All of the nurses and clinicians, physicians work in to combat COVID. We developed a new, for example, a new emergency room, especially devoted to COVID patients, and we use especially established intensive care unit. And all this work was communicated all over Italy with the support of clinical engineers. And it's very important that clinicians are very proud of the work of clinical engineers, and they know that it's important to have technical people inside the hospital that knows what is the instruments inside the hospital, and they are able to take them and to move from a site to another, to be very fast to connect instruments, and to change the capacity of the hospital to move from one situation to another and to combat this virus.
Paolo, you know, you've described your incredibly important role at your hospital and the, you know, the units around there. You've talked about, you know, the national communication with your clinical engineering colleagues. What about your collaborating center during these months? How has your WHO collaborating center around health technology management been able to function?
Yeah, it was also very important to collaborate with WHO because from WHO we received many guidelines, for example, for the, the type of instruments and the type of device to combat the virus, and also about the risk to connected with the infectious diseases. And so a contact with the WHO and the collaborating centers are very useful. For example, also for the use of oxygen in hospital, for the use of special ventilators for ICU, and for new instruments developed especially for this pandemic. It's important also the research and the teaching in this emergency, because we have to support also these two important topics. And so together with the universities, we have people in teleconference that can go on with their studies for clinical engineering studies and bioengineering courses of the university.
Paolo, you've been a long-term board member of IFMBE Clinical Engineering Division, and you've been, you know, practicing clinical engineering for a good while. What's your perspective on the future of clinical engineering in your country and maybe beyond?
I think that in this occasion of COVID pandemic, as I said, the role of clinical engineer inside the hospital was very important. And so we are proud to be a community in Italy and to support the healthcare system to combat the pandemic. I hope that this period would be important also for the future to set some basis of the development of our profession. I hope that in the field of teaching and in the field of training of clinical engineers, maybe in the future some new development about the role and the position of clinical engineers in the hospital. It was clear that clinical engineers in the hospital is important to support the chief officers of the hospital in a strategic decision connected with the emergency in this case, but always during the normal activity of the hospital. There are many strategic decisions to take on. And so the clinical engineers is a staff personnel of the director of the hospital.
Well, thank you, Paolo, for being a great role model of clinical engineering in Italy and around the world. Thank you for your time today.
Thank you, Tom.